Understanding pink eye. Types and effective home remedies. If you or your child are dealing with pink eye, also known as conjunctivitis, the urge to rush to the doctor might be strong. However, in many cases, it's not immediately necessary. Pink eye can be caused by allergies, viruses, or bacteria, resulting in redness and itching in one or both eyes, along with excessive tearing or a white-yellow discharge. Typically, these symptoms subside within a week or so without medical intervention. In my practice, I often encounter cases of pink eye where I typically don't prescribe medications. Instead, I offer parents guidance on managing pink eye at home without the need for antibiotics. This approach can sometimes frustrate parents who expect a prescription when they visit the clinic or urgent care. However, in this video, we'll delve into the various types of pink eye and the appropriate treatments. In this video, we'll share effective tips for treating pink eye at home. Understanding the specific type of pink eye you're experiencing is crucial because the treatment varies depending on the infectious organism responsible for the condition. Different types of pink eye, such as viral, bacterial, allergic, and irritant conjunctivitis, have distinct causes and require different approaches for effective treatment. For instance, viral conjunctivitis, often caused by viruses like adenovirus, typically resolves on its own without specific medication, while bacterial conjunctivitis may require antibiotic eye drops or ointments to clear the infection. Allergic conjunctivitis, triggered by allergens like pollen or pet dander, may necessitate antihistamine eye drops or oral medications to alleviate symptoms. Additionally, irritant conjunctivitis, resulting from exposure to irritating substances, usually improves once the irritant is removed or avoided. Hence, accurate identification of the type of pink eye helps healthcare providers prescribe the most suitable treatment to alleviate symptoms and promote recovery. Before we continue in this video, don't forget to hit the like button if you're finding the information helpful, and subscribe to our channel for more valuable tips and updates. Now let's talk about these types of pink eye in greater detail. Let's start with the most common, which is viral conjunctivitis. It is a form of conjunctivitis primarily triggered by viruses, notably adenovirus, or the same viral strains associated with the common cold. This type of conjunctivitis is known for its contagious nature, easily spreading through respiratory droplets expelled when coughing or sneezing, or by touching surfaces contaminated with the virus. Individuals affected by viral conjunctivitis typically exhibit symptoms such as redness of the eyes, excessive tearing or watery discharge, and a sensation of discomfort or irritation. Initially, the condition may manifest in one eye, but often progresses rapidly to affect the other eye as well. Alongside ocular symptoms, viral conjunctivitis may coincide with systemic symptoms like a sore throat, nasal congestion, or runny nose, and occasionally fever, reflecting its viral origin and potential involvement in broader respiratory infections. Here are 5 effective home remedies for viral conjunctivitis. Warm compress. Applying a warm compress to the affected eye can help soothe discomfort and alleviate symptoms. Use a clean cloth soaked in warm water and gently place it over the closed eye for a few minutes several times a day. Lubricating eye drops. Over-the-counter lubricating eye drops or artificial tears can provide relief from dryness and irritation associated with viral conjunctivitis. Look for drops specifically labeled as lubricating or for dry eyes. Cold compress. Similar to warm compresses, cold compresses can also offer relief by reducing inflammation and soothing the eyes. Use a clean cloth soaked in cold water or chilled eye packs and apply them to the closed eyelids for short intervals. Honey eye drops. Some studies suggest that honey has antimicrobial properties that may help combat viral infections. Dilute raw organic honey with sterile water and use it as eye drops. However, consult with a healthcare professional before using honey in this manner, especially if you have allergies or other eye conditions. But I personally have not tried this one. Saline solution. Rinsing the eyes with a saline solution can help flush out irritants and reduce inflammation. Prepare a saline solution by mixing salt, preferably non-iodized, in sterile water. Use an eyedropper to gently rinse the eyes with the solution a few times a day. You can also buy this over the counter. If you are wearing contact lenses, it's best to refrain from using them until the pink eye clears to prevent secondary reinfection. Maintaining good hygiene is extremely crucial. If symptoms persist despite home remedies, or if there are accompanying symptoms like fever, pain, or vision changes, seeking medical advice is important. Another common type of pink eye is allergic conjunctivitis. It is a condition characterized by the eye's reaction to various allergens such as pollen, dust mites, mold, or pet dander. Unlike viral conjunctivitis, allergic conjunctivitis is not contagious and usually affects both eyes at the same time. Common symptoms include redness, itching, tearing, and swelling of the eyelids. Here are 5 effective home remedies for managing allergic conjunctivitis. Cold compress. Applying a cold compress to the affected eyes can help alleviate itching and reduce swelling. Use a clean cloth soaked in cold water or chilled eye packs, and gently place them over the closed eyelids for short periods several times a day. Antihistamine eye drops. Over-the-counter antihistamine eye drops can provide relief from itching and redness associated with allergic conjunctivitis. These eye drops work by blocking the release of histamines, which are chemicals that trigger allergic reactions. Follow the instructions on the eye drop packaging and use them as directed. Avoid allergen exposure. Minimize exposure to allergens by keeping windows closed during high pollen seasons, using air purifiers to filter indoor air, and regularly cleaning bedding to remove dust mites. If pet dander triggers your symptoms, consider keeping pets out of the bedroom or designating pet-free zones in the house. Saline eye rinse. Rinsing the eyes with a saline solution can help remove allergens and reduce inflammation. Prepare a saline solution by mixing salt, preferably non-iodized, in sterile water. Use an eyedropper to gently rinse the eyes with the solution several times a day. Warm compress. In some cases, a warm compress may help alleviate discomfort and promote eye comfort by increasing blood circulation to the area. Use a clean cloth soaked in warm water and apply it to the closed eyelids for a few minutes. Make sure the compress is not too hot to avoid burning the delicate skin around the eyes. Now let's talk about bacterial conjunctivitis, which is another type of pink eye caused by bacteria such as Staphylococcus aureus, Streptococcus pneumoniae, or Haemophilus influenzae. Unlike allergic conjunctivitis, bacterial conjunctivitis is contagious and can spread through direct contact with infected discharge from the eyes or by touching contaminated objects. Symptoms such as thick yellow or green discharge, eyelids sticking together, and mild pain or discomfort indicate a bacterial infection that may not resolve on its own and could worsen without proper treatment. Seeking medical care allows the healthcare provider to diagnose the condition accurately and prescribe the appropriate antibiotic eye drops or ointments to effectively treat the infection and prevent further complications. Effective home remedies for bacterial conjunctivitis are similar with viral conjunctivitis, such as warm compress, eye rinse. Using saline solution, tea bags used for pain relief, and cold compress. But again, while these home remedies can provide relief for mild cases of bacterial conjunctivitis, it's crucial to consult a healthcare professional for proper diagnosis and treatment, especially if symptoms persist or worsen. They may prescribe antibiotic eye drops or ointments to effectively treat the infection and prevent complications. There is another type of pink eye, but this is less common, and it is easily identified because there is a specific irritant that causing the eye problem. Irritant conjunctivitis is caused by exposure to irritants such as smoke, chemicals, air pollutants, or chlorine in swimming pools. It is not contagious and usually affects only one eye. Symptoms include redness, burning sensation, watering, and sensitivity to light. Irritant conjunctivitis typically occurs shortly after exposure to the irritant and resolves once the irritant is removed or avoided. Last but not the least, neonatal conjunctivitis, often referred to as ophthalmia neonatorum, is a condition that affects newborn infants within the first month of life. It occurs when the baby's eyes become infected, typically due to bacteria, viruses, or other pathogens that are transmitted from the mother during childbirth. Prompt medical attention is crucial to prevent potential complications, such as corneal damage or vision loss. Treatment for neonatal conjunctivitis typically involves the administration of topical antibiotics or antiviral agents, depending on the underlying cause of the infection. These medications are applied directly to the eyes to target and eliminate the infectious agents responsible for the conjunctivitis. It is essential to follow the prescribed treatment regimen closely to ensure effective management of the condition and to minimize the risk of complications. Additionally, healthcare providers may conduct further evaluations to identify any underlying factors contributing to the infection and address them accordingly. Ready to banish that pink eye? Join the conversation. Share your tried and true home remedies that tackled pink eye effectively in the comments below. Follow at VitalityVortex for more health tips and tricks. Let's spread relief together. Remember, while these tips can be helpful, consulting a doctor is necessary if symptoms worsen or do not improve after a few days. If you found this information helpful, don't forget to like and subscribe to our channel for more useful content.